Today we're going to talk about a very common and a serious painful condition known as sciatica. This condition is so common we see day-to-day patients until all the pregabalins or the pregabalin NF, prednisolone, Ultracet, all these painkillers are done, steroids are done, no relief, patients come to Ayurveda and 5 years, 10 years, 20 years of pain, literally until the way of walking, the walking style, the patients start walking like a vulture, the walk changes, and until then patients do not come to Ayurveda. Patients come to Ayurveda after 10 years, 20 years of daily pain, and through Vidya Karma, through Agni Karma, through Ayurvedic herbs, through the simple do's and don'ts for a 10 years of daily pain, we see 50 to 80% pain gone in just 10 seconds. Would you believe that? Today we're going to talk about its permanent cure, and of course we'll be discussing about some successful cases where the patient was advised to operate to get admitted the next day. Patient approaches Ayurveda and through just 10 seconds of Vidya Karma using a pen, pencil or Vidya Yantra, through simple points of 1 second, 2 second, 3 second, we see 80% pain gone as the patient comes down and starts walking. Patient is amazed to see that I just had pain, where is it gone? Through the recurrent Vidya Karma, Agni Karma and Ayurveda hidden treasures, we see complete cure, and this is something we're going to talk about in this video, so make sure you watch till the end. Namaste everyone, welcome to Jovi's Hospital of Ayurveda and Aesthetic Center, Mumbai. You see this word sciatica? To be very honest, it has no meaning. There is no meaning behind this word sciatica. Ayurveda years ago calls this as Gridrasi, has so much of meaning that the patient starts walking like a gidad, like a gridra, like a vulture. You see, while looking at the patient, we can make out Majja Dhatu Vikar, nervous disorder, neurological condition, which is sciatica. The patient starts walking like a vulture. Immediately diagnosis confirmed, no need of MRI, CT scan. Of course, if needed, before after can be easily done. So mainly we see the Vat Prakopit Ahar and Vihar as the major reasons. We see that improper posture, long sitting hours, office hours. We see heavyweight lifting or improper lifting or improper posture as the big reason. What you can take from this video is go bend your knees and go down if you want to lift anything. Keep your back straight. If you're keeping your back round while typing, while working or while lifting anything, the problem is going to start. Keep a straight erect back like how you do a deadlift in the gym. How you do a deadlift, you bend your knees, you go down through your knees and you lift it. So if you take care of this, of course you won't have this problem. And when you do a deadlift or when you lift something in a deadlift position, you see your back muscles are also getting strong. For the males, very important, we see in their lower back pocket they keep a key or a purse or something in their back pocket. The sciatic nerve is constantly being irritated and damaged. Big reason, so make sure you avoid it from today onwards. Firstly, check if you do that. Very important, we see patient have radiating pain. As we touch the L3, L4 lumbar region, patient shouts that yes, I have pain. We touch the buttock area from where the sciatic nerve goes, patient says I have pain. We see patients having radiating pain, lower back se pain jata hai, it goes from the back side, from the lower back towards the legs, lower cramps, tingling sensation, numbness, knee pain. We see all these symptoms and immediately we can say that this is a patient of Gridrasi. So very important is, of course, patient has a huge file, all the medicines are done, has pain, through Vidya Karma, through Agni Karma, so many cases, you can say in every case, we see patient is advised to be admitted tomorrow, comes today with this huge file, we immediately tell them to sleep on the bed, take a pen, pencil or a Vidya Yantra, points done within 3, 5, 10 seconds and patients are relieved. Patient just says that I have pain. We tell the patient before only. So many before after videos we tell the patient you have the pain. Are you sure? Where is the pain? What is the intensity? The intensity is 8, 9. Okay. Come on the bed. Get down 10 seconds. How much is the pain? 50% gone, 80% gone, 90% gone, 100% gone. So recurrent Vidya Karma, recurrent Agni Karma, how using a pen, pencil, needle, Vidya Yantra, copper metal or Suvarna Shalaka, Suvarna Yantra, Raupya Yantra, Tamra, Shalakya, we see through the Shalaka, when the heat is induced, through the Agni Karma, through the Vidya Karma, we see patients are getting the relief. Through the recurrent procedures, we see nerves are strengthened and problem is cured from the root cause. Now, of course, today we are treating through Ayurveda and just Ayurveda in over 50 plus countries. We see patients of sciatica. When we see these patients, we can't do any panchakarma for them because we are here unless we are traveling in that country. But if you're not traveling in the country, of course, we travel, in various countries and see patients and help them come through their incurable disease. But if at all we're not traveling there, we can't come there. We see just through the simple of the simple Ayurveda herbs like the Nirgundi, Bala, we see Samir Pannag, we see Abrak. We see through just the herbs patients get complete cure. Through certain formulations like the Orthomet tablet, through the Palsineuron, through the Vioprin, Vishtinduk, Samir Pannag, through the Mahavat Vidwans, Trayodashang, Brahmi Vati, Bala Arishta, you can say endless list of nerve tonics that give nourishment to the Majja Dhatu and we see lifelong cure. We also see Am, which is the AMA, the undigested waste, as the big reason. Hence, to eliminate that, we have to use the castor oil, which is Erinda, herbs like Erinda, which is Uttam Vat Shamak, herbs like Nirgundi, Bala, and herbs like Hari Taki, which is Harde, which is one of the fruit of Triphala. So such single herbs can also cure the root cause. To be very honest, there are so many treatment modalities in Ayurveda. If we go through the father of surgery, through Acharya Shushruta, we see Acharya Shushruta, the great personality, we see 50% treatment he has said as Rakta Mokshan. Through the affected vein, affected leg, if we do the Rakta Mokshan, patient immediately gets relief. We can do Rakta Mokshan through Alabu, Shrunga, Jaloka, Siravet, so many treatment modalities. If you want to choose Acharya Charak, who is the father of medicine, Basti Chikitsa, there is Matra Basti, there is Yoga Basti, there is Panchadikta Shir Basti for serious conditions. So many treatment modalities. It feels so great to practice Ayurveda that we see just through Ayurveda, just through the Acharyas, just through the Guru Shishya Parampara, the knowledge that we have received through the Gurus and through the Guru Shishya Parampara, it feels so good to practice the authentic Ayurveda and take this authentic Ayurveda to every single person across the globe today. So very thankful to all the teachers for the hidden treasures that they have taught us, for spreading and for spreading this knowledge so openly and with such an open heart that today we see such beautiful results of Ayurveda. So when it comes to sciatica, gridresi, arthritis, painful conditions, neurological conditions, we have so many treatment modalities. It's just the given period of time for a given problem, complete cure. So if you're done with all treatments, choose Ayurveda, choose wisely. This is all for now. I hope you have to take a lot from this video. External Bhaiya Pratisarad with the Bala Tel, Shir Bala Tel, Nirgundi Siddha Tel external application. We've spoken on this channel about Kati Basti, how one can do Kati Basti at home. Patients from different villages have got the benefit by doing Kati Basti at home. We can just take a cloth, a cotton, and put the Nirgundi Tel, Bala Tel, Shir Bala Tel, all these nerve tonics, all these oils over this cloth, make it hot, put it over the lower back area, wrap it with a dupatta or a gauze piece. Complete cure. We see external lepas are affecting patients like Kotam Chukadi, like Ashwagandhadi lep formula, Dinka, Shunti, Ashwagandha. Through all these, Vatshamak Dravyas, Rasna is one of the Uttam Vatshamak, Rasna. So many different treatment modalities in Ayurveda. Complete cure. This is all for now. Any doubts, any questions, please do let us know in the comment section below. Until next time, from Jovis and the team, look impressive, be progressive.